Thank you for joining us in the next installment of the Avenues to Advocacy virtual workshops. These workshops are intended to guide you through the process of becoming an influential advocate for the causes that are most important to you during the 2021 legislative session. It's a pleasure to be with you today. I'm Jackie Romeo. I'm the administrator for the early childhood programs at Citrus Health Network. It's a federally qualified health center in South Florida. I'm also the president of the Florida Association for Infant Mental Health. And today we will be discussing health access and the power of prevention with our panelists that are healthcare experts, which I would like to introduce to you. Joining us today is Dr. Frank Catalano from the Floridians for Dental Access. And Dr. Catalano has been a pediatric dentist and long-term dental educator, researcher, co-founder of Floridians for Dental Access. His work has focused on increasing access to care and oral health care disparities. Welcome, Doctor.
Thank you.
Ms. Ann Swerlik is the Senior Policy Analyst at the Florida Policy Institute and has over 40 years of experience as a public interest attorney advocating on health, economic, and social justice issues. Her work focuses on healthcare and safety net program policy. Welcome, Ann. It's wonderful to have you.
Thank you.
Next, we have Faye Johnson, CEO of Northeast Florida Healthy Start Coalition, which is located in Jacksonville and was organized in 1991 as part of a statewide network of community-based organizations to reduce Florida's high infant mortality and improve the lives of women before, during, and after pregnancy. Welcome, Faye.
Thank you. Thank you for having me.
Last but not least, Melanie Brown-Wolfter, President and CEO of Florida Behavioral Health Association. This is the association, the state's largest trade association, representing community behavioral health providers with a united voice. FBHA advances policy initiatives and is an advocate for better behavioral health for all Floridians. And so thank you all for being here today. For the audience that's with us, please stay with us after the discussion for live Q&A with some of our panelists. And so I know we're here together today to really talk about advocacy and what we can do. I think it's always nice to hear of your own story. So I'd like to start by asking each of you to please briefly share what brought you to health advocacy field. What was it that brought you? If we can start with Melanie, do you mind sharing with us just how you came to this place?
Oh, great. Well, thank you for the opportunity. It's wonderful to be here. And it's wonderful to be here with the panelists as well. So I really respect all the work that each of you do. And again, it's a pleasure. So for me, advocacy started back in my clinical practice days. So I am a nurse, licensed in Florida, have practiced for a number of years, and realized that, you know, on the clinical perspective, I was really an advocate for the patient. And so after I left clinical, I went over to worked at Medicaid for a number of years and became an advocate there. And now am with the Florida Behavioral Health Association, as you indicated. And so that advocacy continues to be able to be the voice for those who don't have a voice or who have a small voice, and those that are suffering or living with mental health issues, as well as substance use disorders, frequently are not heard. So this is an opportunity to be able to amplify that voice and to do some good and to help raise the awareness of the importance of mental health and substance use treatment, and recognizing the importance of mental health as an integral part of physical health.
Absolutely, yes, thank you. So I guess from the beginnings in nursing, let me go to a colleague, a doctor. How did you get started in this field in advocating for?
Sure. So, my background is a middle-class kid who grew up in Brooklyn, went to dental school, immediately became a faculty member. And the first half of my career was very, very busy with all the things a faculty member does. And it was around 1985, I took a position in San Antonio, Texas, and spent a week in a small town in the Rio Grande, San Luis area with a medical team doing a health assessment for the El Paso Health District. And I saw disease, poverty, and hardworking people, and I started to figure out that something was wrong. After that, I moved to Newark, New Jersey, right at the height of the pediatric HIV epidemic. And one of my projects brought me into the Newark ghettos, into the homes. And I finally figured it out, that there was something very, very wrong with our healthcare system, with issues of racial equity. It wasn't so much the oral health issues, it was the broader issues. And from that point on, when I moved to Florida in '95, my career took a totally different focus, and advocacy has been my work. It's the part of it. It's my research and it's my public work.
Wonderful. Thank you for sharing that story. That's very moving. And I think when you're connected to the work, immediately that purpose comes through. And when you find what you're there to do, what you're here, and how you can make sense of it, it's definitely powerful. I know you mentioned moving to Florida in 1995, and I when I was introducing Faye, around 1991 is when the coalition begins in Jacksonville. How did you get started in this journey for advocacy? Faye?
Sure. My journey for advocacy. First, thank you for having me and joining you guys and meeting you all. Some of this is my first time meeting you guys, so I'm excited about hearing all that you do. I've already perked up just by the introductions, like, wow, okay, I have somebody to call on now.
Absolutely.
But I wanted to say, I think my advocacy work started many, many, many years ago as a young mother myself, and being able to advocate for change for myself, you know, and not only that, for my children. And then as I moved forward in my career, I saw where underserved communities really didn't have a voice, and they didn't know how to have a voice. And so we had to figure out how to help them have a voice and for them to understand that they have a voice. And it's important for them to advocate for change. It's important for them to advocate for racial justice and things like that, that they know that will help to better themselves, their lives, and their children's lives. So for many, many years, the coalition started in 1991. I'm a Floridian, but I've lived mostly out of the country for many years, after 22 years of my husband being in the military. And so I saw disadvantaged families, no matter what country we went to. There were some families that just weren't, you know, they needed help or they needed assistance, but they didn't know how to ask for change. So in my heart, every time I tried to move away from social services, touchy-feely, whatever they want to say, and I try to go out and make the big bucks, it'll always lead me right back to this. And so at some point, I decided this was where I needed to be. And I've been in this work now for almost 25 years, and I wouldn't give up anything for it. But I think advocacy, when people understand that they have a voice, and you train them to use that voice, and they see the change that can take place in their lives, it's one of the most important things we can do, and we can offer communities, especially those communities that are underserved. When we look at all of the disparities that are occurring and things like that, I just think it's the right thing to do. How can you do this work and not advocate for change? How can you?
Absolutely. I love just the many layers of your journey. And just, you know, as a mother and a mother myself, I understand that. And certainly as a social worker, I hear that. But I'm glad that you were pulled back into it, because I can't imagine, not having you around to have been doing this work for so long.
Yeah.
And so, Anne, I want to ask you, I mean, yes, of course, we think attorney, we think advocacy, we think, of course, but not necessarily in this area, in this field and around healthcare. How did you come to really develop this passion for health advocacy?
Right. And thanks again for inviting me to be on the panel. It is really interesting to hear people's stories. And I think there's definitely some common themes. I mean, it seems like we've all kind of started on the ground and then saw the need to sort of look bigger at systemic change. But the way I started, most of my career was as a legal services attorney, representing people with very low income on a range of civil issues. But I gravitated towards cases where people were having difficulty accessing healthcare, safety net programs, programs for the uninsured, Medicaid, Medicare, and so forth. And it really opened up my very middle class privileged eyes to what it means to live in poverty. And, you know, just really, I mean, I felt really privileged that the clients allowed me to, you know, get into their lives and really you know, try to figure out, do problem solving with them, to figure out how to get over all kinds of barriers. And, you know, it was access to healthcare, but it's also like, I can't get transportation to my doctor. I'm living in crummy housing, all those social determinants of health. So I really credit my legal aid clients for being mentors for me. And I also, through that work, really learned the importance of policy work, policy advocacy, and how it really connects with people's everyday lives. And I think that connection is often under the radar screen, that people don't realize this problem is because this law is not right, or, you know, this rule, or you need to change, you know, some systemic policy. So that's, you know, that's really how I've come to policy. And I'm thankful that I had the on the ground work that very much helps inform, you know, my policy work.
Absolutely. And I thank you so much for sharing that, because I feel like in those moments of vulnerability or risk, or recognizing, you know, many others may have heard the stories but not really listened, and taken that as an opportunity to see that here was a path for me as a professional to be a part of it. So it does require some, you know, doing and making that happen. So I definitely hear that and appreciate that. And that's not something that's a given, like you said, you know, that it's important to make that connection. Certainly the topic of this panel is all around advocacy, and just really helping those that are with us and watching and listening. How do they do that? How do they make the leap of understanding policy or becoming an advocate? How do we take something that we're passionate about or feel very strongly about, and then put that into action for others? And so I love that the stories, the beginnings, and the journeys were varied, and yet came together in a very shared and sort of unified kind of goal. And so here we are. Thank you for sharing. Faye, I did want to ask you next, what do you see as some of the challenges for children and family in accessing healthcare, just from your perspective and then your work? What do you see the challenges?
Sure. Well, there are many challenges, especially around, and I'll start with the life course perspective, and where people are born, where they work, and where they play. If you think about the social determinants of health. Access, sometimes, you know, when people are speaking about access to healthcare, we think that, well, all they need is a doctor. They just need to go, you know, they just need an appointment, you know, or they just need prenatal care, and that's it. But it's so much more than that access to care involves. When you have women that are depressed, high anxiety, trying to choose between whether or not to go to work because they don't have paid maternity leave, or whether to stay home or go to an appointment, and they're trying to make ends meet for their families, they're most likely going to try to hold on to that job and miss some of those appointments. So when you think about access to care, when we screen women in screening and they're screened for depression, oh yeah, you score in for depression, but you may not be able to get it because you don't have insurance, you know, or there may be barriers to getting the insurance. You may have to wait 6 months into your pregnancy before you get an appointment for treatment for mental health. There are barriers that exist when you're living in poverty and you're trying to survive, and you have the racial inequities that exist when you're trying to move forward, and there are policies and things that are written to where you may not be able to move forward. All those things impact access to care. So it's more than say, you know, well, you had an appointment. Why didn't you get your prenatal care earlier? Why didn't you know you were pregnant before now? Well, I didn't have any insurance before I was pregnant because I couldn't get insurance during the before pregnancy. Now I can get the pregnancy Medicaid, but I already have hypertension. I already have diabetes and asthma and all those things that I'm bringing into the pregnancy. because I didn't have the preventative care. So when we think about all those things that are impacting that, or you may say, why did you stop going to your doctor? Why won't you go back? It was the way he treated me or she treated me. He didn't even really look at me and talk to me, the bias that existed for me to be able to go back, and I'm not going back. I'll just choose the emergency room to go to. So there's so many things that compounded within access to care. There's so many other layers of it, until if we can't help them advocate those layers or bring change, and that's our role, to teach them how to advocate for change with policies and those type of things. If our women could have, after they deliver, Medicaid 12 months past postpartum, if we could get that change where they could continue to have their services after they deliver. There's so much going on around perinatal depression and those type of things where they really need those services. And so those are the things that really drive, especially in my work, the infant mortality. And there's such a big gap around racial disparities as it relates to infant mortalities. So when you think about that, those are some of the things that I think about.
Yeah, and the themes come up, and we know, and certainly thinking, and reflecting back, to last year in 2020, when so many of these social justice and equity issues really came, bubbled up to the point where no longer, I believe, that many could ignore. Certainly not those of us here, because it's what we've dedicated our lives to, and we recognize it and we see it. But it is easy for some to, without understanding context, make judgment around why there isn't. And so having insurance alone is not what gives you access. Like you mentioned, there's many other things that really, when we take into consideration the shared life experiences or community factors. And so I'm wondering, Dr., what do you think? What do you see as some of the major challenges and that children and family that they need in terms of accessing?
Well, yeah, so I'm specifically going to focus on oral health, but the reality is every one of the speakers and the constituents they represent face basically the same issues. And Anne said it when she mentioned the social determinants of health. I mean, for oral health, it's cost of care, and then it's oral health literacy, poor oral health literacy. Parents don't know that if their child has bad teeth and teeth in pain, they're not going to do as well in school. Adults don't know that if they have gum disease, periodontal disease, it's going to affect the management of their diabetes or their cardiovascular disease. And this is not just for, for example, Medicaid patients. I mean, only a small percentage of Florida Medicaid patients got to see a dentist last year. But it's an issue for middle class people also. The other thing, and you'll get a kick out of this, today at noon, I did a webinar with the Legal Aid Society. And Amy Lim reminded us all of the horrible complexity of the Medicaid system, and for parents to be able to navigate that. And it's gone through so many disastrous changes in Florida over the last decade or 2 decades that I've seen. So, the barriers are cost, oral health literacy, and a difficult system to navigate. That's the big issues for me in oral health arena.
Thank you, Doctor. And definitely I'd like to bring Ann in, because you did make that connection of, this is where you need this level of expertise. Should we need to have an attorney try to figure out, the language, the laws, the rules, how to access or navigate, or where there's limitations. And so, Anna, given the challenges that we've talked about, that we know because we see it in our day-to-day work, what do you see moving into 2021 in terms of the legislative calendar, top policy and program priorities? Where are you at with that, knowing that this is what it looks like right now? Where do we look to?
Well, there are two priorities I wanted to quickly talk about. One is an old standby, and I'm envisioning eye rolls out there, but we are still championing Medicaid expansion. And this is very much a key issue because we have projected over 160,000 uninsured parents with very low income of minor children who would be helped if we expanded our Medicaid program. And of course, we know when parents are insured, their kids are more likely to be insured. The kids are more likely to get checkups, and the kids overall, having insurance is a good predictor of lifelong positive benefits, like being able to be a self-sufficient adult. So Medicaid expansion is very much an issue for child advocates. We, aside from the incredible health benefits that are being substantiated by now hundreds of studies, because we now have 39 states, including DC, that have decided to expand their Medicaid programs. And notably, none of them have opted out. And that's because it's an incredibly good deal for states. Not only are there amazing healthcare benefits, but the research shows that the state could actually save money in their budget if we did expansion. And Florida Policy Institute has done a rather detailed report that's on our website that projects that the state could save nearly $200 million a year if we expanded our Medicaid program. So now is like more than ever we need to be talking about this. And not only to help our state budget, but also we would have over 14 billion new federal dollars flowing through our economy. And we know those kinds of dollars would be a tremendous fiscal stimulus, helping us to keep jobs and just generating lots of economic activity. So you're going to hear a lot about Medicaid expansion this session. We're optimistic that we might be able to change some hearts and minds and not make it such a unfortunately polarized issue. The other issue I want to talk about is one that relates to health disparities. And there's been other people that have referenced this, that COVID has really awakened a lot of people to these issues. And one of the things that we're advocating through there's bills that are going to be filed is to use our Medicaid managed care program as a way to address health disparities. Currently, and when I talk about health disparities, I'm talking about differences in health and access to health care by certain groups, and there's including people of color. So for kids, we know children of color fare worse on a whole bunch of healthcare indicators, and Medicaid has a disproportionate number of kids of color enrolled in the program. So what we're proposing is that OPP is already collecting a lot of data from these plans on how well performance measure data, on how well they're serving their enrollees. What we're asking that the next step be, you've got to really break down this data for how well are we doing for particular populations. So there's been a lot of chatter. OPP's put out a lot of information about how we've improved quality, but if we're really serious about making a dent in disparities, the first step is really drilling down on that data and publicly reporting it. So those are two priorities, and I won't spend any time on this, but I do want to make a plug also for extending postpartum coverage to a year for women who are getting Medicaid through pregnancy. And I know Healthy Start's taking a real leadership role on that, and that's a terrific initiative.
I see Faye shaking her head and saying, absolutely, yes, yes, yes. And so thank you for sharing that. It's important. We have to have these conversations. We have to bring this to light. And so if this is the beginning of someone hearing about a particular policy or area where they see how important that might be for them to support, because it directly impacts the clients that they work with, the communities that they serve in. And so I appreciate that. And I'm wondering, Melanie, what do you see? What are you focused on for this 2021 legislative session? What are the priorities you'd like to see?
Yeah, thank you. And so I agree with my panelists in terms of getting back to some of the barriers as health literacy I would offer, as well as oral health literacy in the complicated system overall, not just in Medicaid, but commercial plans, Medicare. It is very, very difficult to navigate the system, even when you are familiar with the system and are part of healthcare. One thing I would like to add for in terms of individuals who are living with mental illness and addiction is stigma and a sense of shame. And that creates a barrier for individuals to seek care. Individuals experience that in their communities with their neighbors, as well as in the health professions with their caregivers. So this is something that we need to really realize, that mental illness and addiction are medical disorders. They're just like having a heart condition or having cancer. And these are lifetime events and lifetime illnesses. And so just being able to lift that and have folks be able to come forward without that, like I said, a sense of shame or that sense of punitive care, for having the addiction or for living with a mental illness. And along those lines, so for us, the challenge is to raise awareness of the importance, to really look at fully integrating mental health services or behavioral health services along the continuum of care, from infants all the way through the elderly, and to integrate that in terms of the services that are available in health systems today. We really want to be able to work to ensure the sustainability of the community mental health and substance use treatment providers. Those are long-standing community partners that have access, that provide access to care for many, many individuals and communities across our state. And we would like to do that by increasing the workforce, using the APR to be able to discharge in a Baker Act setting, as well as increasing the services that they're able to provide, using peers, removing some of the barriers and background screening to peers, because just as we've said, the system is complicated, and having a peer help you navigate is a wonderful, wonderful tool. It helps to reduce cost, it improves quality, and it is something that we need to think about. So, we really just want to increase awareness, have folks recognize the importance of mental health treatment, of behavioral health treatment, and increase workforce and ensure access to quality care.
Yes, well, it's certainly music to my ears when anyone mentions infant mental health and early childhood mental health, because we know certainly it's something I dedicate a good amount of my time to, but understanding the importance of healthy beginnings and how healthy development includes healthy social emotional development and mental health for children, understanding the relationship. We've talked about maternal depression and the impact on a child's development. Also, just the uniqueness for children, different than adults. A child has to rely on an adult caregiver for their medical services, treatment, interventions, and care. And so it's really that much more important to make sure that we can support caregivers, parents, families within a system that is diverse and equitable and inclusive and easy to access. And that we understand through literacy why those things are important. And so thank you so much, because I feel like they're all of the layers though interconnect. And
Yeah.
so it's a piece of a puzzle that I think
Yeah.
together, working on it, we can get to that point. And so I know that, our time is kind of coming to a close, and I think it would be safe to say that we could spend a lot of time talking about this together, and thinking of some solutions or way to partner around some solutions for our own communities across Florida. But I would like each of you to answer this last question, because I'm very curious about it. What would be a measure of success in the year ahead? What in 2021 would be a measure of success? So that's a loaded question, but I'm sure that there's something that came to mind. A, we lost you for a minute, you're back, and I know you know what you would like to see and what you would consider to be success in the next year.
Oh man, and I apologize. Our connection went down, so I'm glad you letting me go first, just in case it happens again. I'm not sure. But when you think about success, what does that really mean? I'm not going to take up much time because I know we're fast. But I guess for me, I could go broad and say, of course, I would like to see the infant mortality rate decrease considerably within this next year. With that, you would have to have some true legislative focus and policy change. So for that to happen, a lot of things will need to happen. I would like to see the racial disparities gap in infant mortality decrease as well. So those would be my measures. But overall, I think when we see a deliberate, consistent focus of policy change that will address some of the social determinants of health that's impacting infant mortality, that would be my measure.
Thank you. Doctor, thoughts?
So it's an easy, short answer. Passage of Senate Bill 604. And hopefully next week we'll have the House bill. What we're trying to do is bring a new member to the dental professional team in Florida called dental therapist. They've been in the United States for 15 years in Alaska, Minnesota. 13 states have now passed this legislation. And these professionals work under the supervision of dentists, but data is unequivocal, safe, high quality, and very cost effective in reducing the cost of delivering dental care. And that's particularly important with Medicaid patients because the fees are so bad. So it's going to be hard to get there. We got strong opposition from the Florida Dental Association, my former trade union, I call it. But that's our goal.
Wonderful. I like specific, I like clear. We talk about data there coming back in, and then data related to policy. And what do you see as success in the 2021 legislative session?
Well, going back to a Medicaid focus, I think there would be success if we hold the line on not having cuts this year, because that's very much in the chatter, which makes no sense to be cutting this program in a time of a pandemic. That's when people most need it. I would love to see some of these Medicaid initiatives like coverage of postpartum women up to a year, Medicaid expansion. I think Medicaid expansion distinct from the postpartum coverage. But I think in big picture, I'd like to see if we could take some of the politics out of public health and healthcare, and to see some good policy advance based on facts and science. I would say that would be a huge success.
Well, it sounds good to me. I think when folks have good intentions and you have good information and the will to do good, I agree. I think I don't think you'll have anyone that will argue otherwise in this group. Melanie, what about you? What do you see as your vision for success in this next coming year? What would that look like for you?
So my vision for success is that we work to ensure that we broaden the access to quality mental health and addiction services and treatment. And we do that in a variety of ways, including, expansion of workforce, use of telehealth, and continuing the telehealth flexibilities that we are experiencing in the pandemic. As well as ensuring that there's funding for the community provider and for quality services. So we would just like to see that there's a greater access and that we work to reduce the stigma, increase the awareness of the importance of mental health, and create a sustainable system of care.
Well, in the short amount of time, we have not only gotten to know each other better, but certainly for me personally is a reigniting of a passion, of a drive, of re-energizing. It is a new year, so this is very timely, right? There's something about new beginnings. There's also many changes. And so when we think of that vision and we think of that future that we envision for young children, and especially I think we've all said it here and can agree that when we want all children to be healthy, to have access to good health care, including mental health,
Yes.
for themselves and for the parents, we also have to make sure that maybe we start with those that are furthest from the opportunity. And I've heard that over and over today with you, that we intentionally work very hard and very diligently to reach those populations, those groups, those communities, and understand them, and what is a barrier, and help kind of build that bridge so that we can bring them to where we know that they need to be, so that our future is healthy. I think we would all agree every child deserves quality health. And
Yes.
And so I hope that this session has inspired you out there who's listening, and those of us that were here in this time together, to continue forth and really continue with your advocacy efforts, whatever that may look like for you, if it's at your place of work or in your community, or if you're volunteering, or within your own team. I think there's so many levels to advocacy where we can really be agents of change. And so if you know of a well-deserving individual who has worked and advocated on behalf of Florida's children, youth, and families, please consider nominating them for this year's Children's Week Florida and Child's Advocacy Awards. And so this is new and it's exciting. It's a new award this year with the help of our advocacy partner, United Healthcare, which is focused on teens and youth who have demonstrated great leadership and advocacy efforts in their local communities. We ask you to please visit www.childrensweek.org for details and to submit your nominations today. And so how wonderful, right? That it's not just the adults, right? But that we're really looking at, teens and young leaders and the next generation to really start their advocacy early, and certainly help to bring about a lot of change much earlier. Thank you for spending your time with us this afternoon. We hope you will join us for next week's session, again, virtually or in person, and for the culmination of activities and the events for Children's Week Florida, which are going to take place April 5th through the 9th. Thank you again so much to our wonderful panelists. It was wonderful to have you with us this afternoon, and we really do appreciate your time and all the work that you do daily to advocate for the children in Florida. Thank you.
Thank you.
Thank you. Thank you.
Good to see you all.
Bye-bye.
Hello, it's Jack Levine with Four Generations Institute. We have all 5 of our special guest panelists still with us, and we hope you will stay with us as well as our wonderful audience. I am stirred by the expertise and the beauty of the conversation so far on such an important issue. And I'd like to start this Q&A session with a question that I know is on all of our minds, which is the advent of our COVID crisis. There's no doubt in anybody's mind that the headlines are screaming about what could be done, what should be done, and how that affects every stage of life and every community. So I'd like to do a quick lightning round for our 5 experts, our quintet of expertise, to answer this question. How has the advent of this current 1-year-old plus COVID crisis affected your neck of the woods, your world of health access? And I'd like to start with our panel moderator, Jackie Ramil.
Thank you. Good afternoon, everyone. Thanks again. This, as you said, has been a wonderful experience. And indeed, I don't think that there has been one day in the last year, close to a year, that we have not said COVID at one time or another during the course of the day. We had to change completely. Certainly in my neck of the woods, South Florida, Miami-Dade County, one of the very early on and continued on to be a hotspot for COVID. The way that our priorities and the way that we had to change how we were able to show up for our clients and for our patients. Access is always important, but for a community-based center where most of our patients and clients were used to and very comfortable and relied upon physically coming to see us and being there with us and their provider and the safety and security of that, and then suddenly having that not be an option, we had to very quickly become innovative, with the right technology, accessing, connecting. I think even the extent to which we had to use our staff differently and our expertise differently to make sure that we could reassure those that we serve that we didn't have all the answers. We didn't know exactly what was going to happen, when it was going to happen, or how, but that we had their back, that we were in this together, reassuring our own staff because this was a parallel for all of us, but certainly for our clients and patients, that we were going to find a way to get them their medication, to make sure that they had their appointments, to make sure that they were able to speak with whom they needed to speak with, whatever level or kind of provider that they needed. And so I think the connection piece, the remaining connected, was paramount for us and a priority.
Thank you, Jackie. We'll shift over to Faye and ask Faye to respond to the same. The advent of COVID, how has that affected Healthy Start services from your perspective?
Sure. We, as you all know, and thank you for having me again, there are 32 coalitions across the state of Florida. We work closely with and represent the Florida Association of Healthy Start Coalition. And I can tell you that all of the coalitions went into what I would call an overdrive to ensure that families were still being served, because at that time we were not going to be able to do home visitation, which is our hallmark. We're the boots on the ground. We're going into the homes. We're making sure that the families have what their needs. But I would say all of the coalitions across the state of Florida, we did everything from drive-through baby showers to delivering diapers and Pampers on the doorstep while maintaining social distancing, making sure we had our virtual platforms up. And not only that, the telephone calls so folks could just call in. Because when you think about COVID, I don't know about you guys, but for me, I'm such a relationships person. Until, you couldn't go in and see people anymore. You almost felt like, you were in isolation in a way. And our families, especially, and our moms and new babies and folks with depression, we were concerned about that. What are they experiencing during COVID as it relates to isolation and not being able to really see their home visitors face to face and those type of things, even though we made sure that we put the telephone calls in place, but everybody may not have minutes on their phones. And this goes back to the whole social determinants of health. Everybody may not have a car to be able to get to a drive-through baby shower and things like that. But I can say that for the coalitions across the state, we stepped up and we're still stepping up to ensure that all of our families across the state of Florida have access to what their needed services are. So
Thank you, Faye. And we know that today is the day of birth of about 610 Florida babies, and there are no days off. So the idea that externally we're challenged, we have to continue that commitment to their own health. I'm going to move over to Anne. Anne, how from the legal perspective and from the policy perspective has COVID affected those who you are aware of?
All right. Well, unlike some of your other people on the panel, we're not a direct service agency, but we still very much miss the in-person, face-to-face contact, because what we do, of course, is in addition to research, trying to educate and do policy advocacy on a number of really critical priorities for low and middle income families in Florida. So COVID has just amplified the need for us to get out and educate people on why it's important to invest even more in health and human services in our state. And so I'd say our priorities have not changed in terms of our policy focus. I mean, more than ever, we need affordable, quality health care. We need to address growing food insecurity, and the list goes on and on. So I'd say a major shift for us has been trying to maintain those relationships outside of the in-person face-to-face. So we've been using a lot more, Zoom platforms and webinars to try to get the word out on why it's important to do work around common sense policies, and to keep our partners engaged. And I have to say, in some ways, I mean, I know we're all sick of Zoom at this point, but it has, for many, it's been more convenient for people to participate and get involved with some of those issues. So that's been a bit of a silver lining.
Thank you, Anne. I'm going to move up to Melanie. I know the impact on our mental health and substance abuse and other behavioral health issues has been tremendous. Can you please articulate how you see it from your vantage point?
Well, thank you. And thank you to everyone for the opportunity to be here. What we've seen over the pandemic is initially there was a decrease in the number of individuals presenting for services because folks really started quarantining and not coming in, and that was a great concern. We've seen the community provider rapidly expand the use of telehealth and be able to pivot to increasing the telehealth services that were available. Almost everyone used telehealth, but we really expanded it over the course of time. As Jackie indicated, safety was the first concern, not only of the workers there, but of all of the clients and families that we serve, addressing food insecurity, making sure they had access to services, pivoting and changing the structure of some programs to include that audio only by telephone component as well as the telehealth component. Mm-hmm. And as time went on, and starting in early fall, we're now seeing an increase in the number of people presenting for services. And unfortunately, we're seeing the acuity go up so that when individuals present, they're deeper in their crisis. Mm-hmm. And so it's raised the intensity of the services that need to be provided as well as the length of care. And we're also seeing individuals present who were previously not known to the system. So, more people are now coming in and the acuity is higher. The providers have worked tirelessly. No one closed their doors. We were available 24/7 in the community. And they've done just an outstanding job at being able to meet the demands of, being safe, as well as serving the needs of the individuals, because some services have to be provided in person. They can't be provided via telehealth. So I'm just, we've just been there, and the load has been, the increased demand is amazing.
Thank you, Melanie. Frank, I saved you for last because I can't think of anything on the spectrum of health and medical services that is more intimate and more face-to-face than dentistry. So,
Jack, unfortunately, absolutely right. So dentistry had a unique problem. I mean, dental hygienist is working on your teeth and working on your mouth. They're this close to your face. It's a respiratory transmitted disease early on in the pandemic. So essentially what happened in the very first couple of weeks is probably 90% of private dental practices shut down. And that includes dental practices that deliver care to underserved patients, Medicaid patients, and whatever. As we learned more, and as dentists started to utilize all the safety technology that's out there and to help prevent the spread of the virus from them or from their patients, things got a little bit better, but they are not great right now at this point right now. And in particular, this is where COVID really exposed the racial inequity issues and the issues of the underserved patients, particularly those on Medicaid. A lot of private practices have come back. Less so for those that take care of Medicaid patients. And we have reasonably good data about this from the American Dental Association Health Policy Institute, which has tracked this. And I want to make sure I'm not misunderstood. There is very little evidence of transmission within the dental office, particularly if the dentist, the dental hygienist, and the team members follow all the safety protocols and recommendations that are out there. And they're careful about what patients, they know that you can do rapid testing. So drastic effects on dental care, long-term serious consequences. Children go without care for months, can move very quickly in young children. We're going to come out of this. We are starting to come out of it, but it's been very difficult for dental care.
Frank, I'm going to do a quick follow-up with you. We had a participant, an audience member, ask a question that had to do with a dental health bus that is operating in Escambia and Santa Rosa County in Western Florida. And what do you know about access to mobile dental care, and does that fit into your vision for your reforms?
Absolutely. So, so very, very specifically, new oral health professional that we're talking about in dentistry, the dental therapist that our Senate bill would be able to implement. The way we work in Minnesota is primarily remotely. So there's a wonderful charity there called Children's Dental Services, used 2 fixed buildings. They now, with their dental therapist team and portable, serve 500 sites across the state of Minnesota. What they do is go to schools, set up portable equipment, and deliver care, taking that burden off that parent who may have an hourly job at Walmart, taking the burden off them having to take off from work to bring their child to the dentist. Now the dental team goes to the school. So our legislation will help address that and improve that, and particularly our state where we don't have enough school-based health programs. This could be a tremendous asset.
And to add to that, I know there are some mobile optical services that go to schools and check children's eye needs and vision capacity. So that's another example of mobility.
Sure.
We have another listener who is very interested in a broad topic, but I'm going to help hone it in, and that is the value of prevention. The themes that we're hearing around the block is, it's not whether we pay, it's when, and how, what the services need to be to avoid later costs. So I'd like to again go around the horn and see if we could articulate in just a moment or two the core essence of the value of prevention in the services that are necessary to be funded. And I think primary prevention begins prenatally, so I'll ask Faye to address your perspective on that.
Sure. Well, Jack, to be honest with you, it begins preconception, early on, before mom even becomes pregnant, or a young lady becomes pregnant. Her body has already been impacted by what we call the weathering system, whether it be through chronic disease and those type of things that she may have not received care for, to prevent those things from impacting the pregnancy or the birth outcome. So preconception health is very, very important. If mom were to be able to have those services early on to prevent, how should I say it? Well, I won't go into that, but to prevent, like I said, a poor birth outcome, because moms need to be healthy before they become pregnant in order to have a healthy birth outcome. So if I had to say anything, I would talk about preconception health as a preventive measure to improve the birth outcomes of women and babies.
Thank you. In the behavioral health arena, Melanie, the definition of prevention from your perspective.
Oh, so I would say it's two parts. It's both children, including infants, all the way through adolescence, and it's adults. So to address the current needs of adults and children who have had traumatic events, who suffer with depression, maybe they have an emergent psychosis or schizophrenia, as well as looking upstream so that we can prevent that trauma from occurring again, so that we provide services to the adult to be able to mitigate the problems that they have and allow them to give them some tools to be able to move forward, as well as looking at ways to avoid those situations in the present, which would be, looking at the mental health of infants and children, all the way across the continuum.
Thank
you. A comment from you, Jackie?
Absolutely, I would echo the same. We know the literature, the science, the data it's clear. It's been demonstrated. Children who have healthy beginnings have lifelong success and beyond social, emotional, developmental health, educational, professional. So it really does make sense to invest early, prevention, supporting families, caregivers. Children rely on their caregivers. We have to support families and caregivers, and that includes, early learning professionals. I know that's the next panel session for next week, but it's a nice segue in that, quality early care. It's critical. We have to invest now. The first 5 years of life are absolutely critical for lifelong success.
Thank you. And very quickly, does Medicaid enhancement really help us with the preventative health services?
Right. Well, I think, yes, because Medicaid is a policy that absolutely gives people more access, and children in particular, to preventive care. And you've already heard, how getting kids access to those services is just so critical to their development and being successful adults. And I'd like to add another critical policy to support prevention, especially for children, is making sure their parents have coverage as well, because we know if parents have coverage, their kids are more likely to access services, they're more likely to have insurance in the first place, more likely to get the preventive care and to address problems early when they're less costly and serious.
Thank you. Thank you. And Frank, our anchor man, I think the core of your positions on expansion of dental access is prevention. Is that correct?
Absolutely correct. So, and your introduction was great. So a number of years ago, I actually wrote a paper, Pay Me Now or Pay Me Later. Let me give you a very specific example. I'm only going to focus on children. Prevention for children for dental disease involves bringing a child to a dentist before age 1, brushing the child's teeth with a fluoridated toothpaste, watching what you put in the bottle, and having the dentist or the dental hygienist apply fluoride varnish. That costs Medicaid maybe $100 a year per child. One hospital emergency department visit costs over $2,000. So if I could prevent just one visit, I can provide preventive dental care to 20 children. So it's very
Thank
straightforward.
you. Thank you. In each of our testimonies, the idea of it's not whether we pay, it's when is very, very clear. I'm here to thank each of you for participating. We are at the close of this session. We have additional sessions in our subsequent Mondays at 1:30. You will receive more information about those, including our wonderful early learning session next week. And please visit childrensweek.org to find out more exciting news about our awards program and our Avenues to Advocacy series. Thanks to each of you who are tuning in, and we very, very much honor all of those who have brought their expertise to this great process. We don't choose to be separate, but we have chosen to be connected. So thank you so much, and stay well, everybody, and get your vaccines when it becomes available. Thanks
Thank
so
you all.
much.
Thank you, Jack. Thank you, team members.
Thank you.
you.
And thanks to the Children's Forum and all of our sponsors. Stay well, everybody. Bye-bye.
Bye-bye.